So thank you so much for this opportunity to present at this great conference, for sharing knowledge, and I'm sure we shall implement. Now, I really appreciate the organizers of this conference. So if I start with ourselves, our bodies, I want to comment the talk of Come from the Facebook, who says healing is within your reach naturally. Medicine is not only found in bottles or tablets. Exercise is medicine, laughter is medicine, fasting is medicine, nature is medicine, vegetables are medicine, sleep is medicine, gratitude is medicine, meditation is medicine. So can I go to the structure, the first slide, please? The first slide, yes, that is the structure of the presentation. The introduction, then why the study, then methodology, results, discussion, conclusion, references, and appendix. Next slide, please. Now that is my title. My paper title is Incorporation of Suitable Nutrition in the Management of Diabetes, which is a case study by Asiko Grace and Dr. Ngare Stanley. So the next slide, please. Abstract, just jump the abstract, go the next. Next slide. Yes, that is the introduction. We know globally about 589 million people have diabetes, out of which 25 million are from the region of Africa. And 6 persons in 1,000 have diabetes. Diabetes is thus, it remains a global health crisis with prevalence rates continuing to rise. That is by Ngugi 2025. Diabetes is a pandemic with a huge economic burden, affecting close to 2.3 million people in Kenya, with 50% undiagnosed. In children, 55% are either misdiagnosed or underdiagnosed. Most diabetic cases are type 2. The recent national survey in Kenya show high prevalence in low-income urban areas within Nairobi, with a range of 4.1 to 5.3 in 2025. Diabetes is systemic, requiring systemic approach in its treatment and management. Multidisciplinary approach, that is insulin injection, drugs, exercise, nutrition, and peaceful environment should be employed on complementary basis. That was by Powers, 1996. Spending time in green spaces has been shown to reduce the risk of diabetes, heart disease, and high blood pressure. That is by the Greenpeace Africa 2025. Health, next slide. Health, food, and nutrition are intertwined. Globally, close to 3.1 billion people cannot afford healthy diets. That's FAO 2022.
Next slide has not come.
Sorry?
Next slide has not come. You are speaking the whole slide.
Next, no, yeah, next slide, yes. I'm continuing with the introduction.
Yeah.
Yes,
yeah,
yes.
Please continue.
Okay. So then we're saying that having food to eat is fundamental, but having access to the right food is just as crucial. That's by IFAD 2022. So there's growing evidence indicating that type 2 diabetes could be reversed with proper management involving urgent monitoring for blood sugar, appropriate and healthy nutrition, exercise, and lifestyle change. Can we have the next slide? Why study? Why this study? There is increasing numbers of diabetes patients in Kenya. The economic burden is too great to those families affected. Then there's limited awareness, and there are rising complications if untreated. then it's possible that you can prevent diabetes. Next slide, please. Methodological approach. This was a case study that was done on a volunteer diabetic individual for blood sugar monitoring. The age bracket was 60 to 65 years old. Weight reduction was prioritized, 68 to 62 kilograms. Results from other patients could not be incorporated due to ethical consideration. So we go straight to blood sugar monitoring. The gadget that was used was the capillary blood glucose testing with finger sticking device and Lancet medicine MM1200, which was self-calibrating, as shown by there's a figure 1 and figure 2, which gives both the gadget together with the specification, giving an estimate of blood glucose level increment in mg per dl. This was done after the initial insulin injection that was administered after 2 weeks, for 2 weeks. Limited precision drugs were also administered, that is metformin and glucophage, and there was calvonate also and others. And these were prescribed accordingly. And also a rich mixed diet as per the World Diet Classification by Russell. That is 2023, consisting of cereals, fruits, and vegetables was introduced. In addition to exercise.
Madam, which slide you are speaking? This is something is here. You are telling something.
Methodology. That is methodology too.
Here the slide is methodology approach to diet. About diet, something is there in this slide. Now,
what is missing?
Which one you are speaking?
Sorry, there.
This is the methodological approach and
yes, to
diet. That is the slide number 2, diet.
No, I started the blood monitoring. I started the blood monitoring. Then I finished with that. Then I go to diet.
Yeah.
Yes, you are right. That's diet. So the diet was based on the world diets that was done by Russell. That is 2023. The mixed Mediterranean, Indian, and local diets. So when we incorporated the local diets as per the doctor's prescription, there's the fixed size whole carbohydrate meal, which should be either brown, we call it ugali in Kenya, or brown rice. Everything is brown. For diabetics in Kenya, everything is brown. Then there is the quarter plate of vegetable, a quarter plate of protein, that is either white meat or fish. Then there is the avocado, olive oil, and nuts. Those fall in the same category of good cholesterol. You can choose either of them. Then there is the broccoli, cabbage. Then there is the coriander and rosemary. Then there is also the stingless bee honey, which has low glycemic index. So can we go to the next slide? Vegetables. Yes, thank you. Vegetables were selected from an array of the recommended available leafy vegetables and others, just like was recommended by the American Diabetes Association. The Kenyan choice was for the volunteer was okra, cucumber, Gives mallow, crotalaria, spider plant, that is a Gynodropis kenanthra, then nightshade, that's Solanum nigrum, then there's the Amaranthus species, spinach, cowpea, that's Regina unguiculata, that's by Linnaeus. Can we move the next slide, please?
Is it monitoring
next
blood
slide?
sugar? Results are
That
come.
is the next one is what? Oh, that is great. That's great. Thank you. This is now the have you moved to the which one is this? The last this one?
You have any previous slide?
That was the vegetables. Yes.
Next slide.
So now,
results.
Yes, the results starting with which one? Monitoring. Yes, monitoring. No, sorry. Can we just go straight to the results? The picture, the figure 2. Yes, thank you. So that is the management of diabetes in an individual. That is the volunteer individual by injection, precision, drugs, diet, and exercise in the year 2021 to 2022. That is the October of 2021 to August of 2022. So there was progressive monitoring for glucose blood level on one volunteer diabetic. And as we mentioned earlier, in the first 2 weeks, insulin was administered. Sorry. Followed by, metformin, basically, plus other drugs which we have just discussed. And then there was a steady rise. And once the exercise was introduced, once exercise was introduced together with the medication, there was a steep drop of the spike. And in around February, they continued with the exercise together with the diet. Medication was halted. So basically, it was medication, it was exercise and diet, the mixed diet that I have mentioned, partly Mediterranean, partly Indian, and then the local. I talk of the Indian because there are a lot more of spices, nice spices in there, which are very medicinal. So it was stabilized. It was finally stabilized from the sharp spike of 7.6 to the leveling or up of by 5.2. And that was maintained for a long time. Those were averages. And the majority of them, the readings were 5.4, 5.2. Actually, it was manageable. And it was indeed reversible. And the patient is no longer dependent on medication, but follows strictly the diet and the exercise. And the exercise, okay, when we got the diet results, we find that the all-encompassing mixed diet, including honey and fruits, and the fruits that were recommended were the low sugar ones, like the apple.
Excuse me, you have to change the slide.
Next slide. You have to change the slide, please. Next slide. That is, they are tiny, they're on phone. So result, that is which one now? That's diet. Yes. Then there were the pawpaw, the oranges, then thorn melon, and other available which were in season. These were assessed on the basis of their proven history and individual preference. The media had great influence in the choice of fruits and vegetables through intensive awareness on fruit, vegetable, value, and ability to cure specific ailments. Apples were advocated for keeping the doctor away. Avocado was good fat. Thorn melon was lowering blood pressure. And stingless bee honey was having the low glycemic index to manage the blood sugar spikes, as approved by the Australian New Zealand Food Standards. That is in 2024, for stingless bee honey as being labeled healthy sugar source. Then we got the results. The next slide, vegetables. The greatest positive impact was achieved by consuming the cucumber, okra, juice mallow, crotalaria, that is, and in combination with other vegetables, which we mentioned earlier. So in the lowering of the blood sugar level, the inclusion of honey, we have said, because it has a lower glycemic index. And then we find that honey and other hive products contribute tremendously to food security, nutrition, and improved health by complementing conventional medicine through apiculture. Medicinal herbs exhibit also great potential, singly or in combination, to drug development to treat and manage diabetes, cancer, and hypertension. This concurs with other researchers working on coriander, that is Coriandrum sativum, and the rosemary, Muraya Koenig, for cancer cure, that is Zora et al., 2022. So I go to the next slide, which is discussion, please. Can we move the discussion?
Any question? Any discussion from audience?
Sorry?
The discussion, she is still continuing, no?
What is the discussion is?
Please continue your talk.
Please continue.
Yes? Discussion for number one, monitoring discussion of diabetes now. Diabetes patients die as a result of hyperkalemia and hypoglycemia and other complications due to limited awareness. Self-monitoring proved effective despite the discomfort in finger piercing. The capillary blood glucose test was simple and accurate, with disposable needles and lancets limiting the possible infection and blood contamination, though adhering to the test schedule was a challenge, together with the surgeon phasing out of the monitor model used. The purpose of monitoring patients with diabetes is to identify treatment needs, to evaluate the effectiveness of treatment, and help patients to avoid extremes in blood glucose levels, as earlier discussed by Judith in 1996. The acceptable range of blood sugar level is 4 to 7 mg/dl by the World Health Organization, and also the other diabetic talks on Facebook and elsewhere, and other social media, and the American Association American Diabetes Association in 1994. They recommended balancing of food intake with exercise and medical management to achieve a near normal blood glucose as possible and optimal serum lipid levels, which are major challenges to diabetic patients. Then there's also the continuation. Type 2 diabetes is systemic, like we have noted, and it requires systemic approach in treatment and management. So there has to be comprehensive methodology. It has to be comprehensive and to be done only with drugs that, in addition to lowering the sugar levels, ensure the safety of the rest of the body. And a team of researchers working on diabetes treatment and management in Kenya recommended diabextan, which is a natural anti-diabetic complex with over 60 different active components. The drug contains all the vitamins, macro and micro elements most necessary for diabetes.
Go to next slide. Next slide. Please go to next slide.
Yes,
This is
okay,
the
okay.
slide. Next slide.
Okay, then it's okay. So, next slide, please.
This is your
Can you move to next slide? Move to next slide. Yes, there we have talked of the multidisciplinary approach, and we know the injection and then the drugs, exercise, nutrition. Then you require the peaceful environment. Next slide, please. So we know the best drugs for that is low insulin, metformin, but there are many others that are being used. Some are inhibitors in combination with metformin. Then metformin is always the first choice because it lowers the amount of glucose the liver produces and helps in insulin utilization. That was by the Diabetes Research Group 2025. Then discussion for diet. Move next slide. Oh. The mixed diets we have said they are essential as the availability of nutritional requirement. Though Mediterranean diet is recommended by Brussels 2023, the local Kenyan diet also proved best with therapeutic traditional vegetables, and whole brown grains which survived. Fruits were selected according to their availability and proven therapeutic value we have just discussed. So I think we have okay, next slide. Discussion on the dietitian. Dietitian is a really crucial member of the diabetes team, and whose expertise helps shape the diabetes treatment, as we have noted by several workers, including the American Society for Diabetes Association. So diabetes can be, okay, it is all multidisciplinary. So we should also include the green space. We should also include the green space, and we have noted many of these things. So we move on to the next one. The last bit about these other workers who did a good job and even recommended development of medicinal herbs like the Muraya Konigi and the Coleantrum sativa to the development of drugs. That is Zora and her colleagues. So can we move the conclusion slide? Conclusion, please. Diabetes 2 is not a death sentence. It is reversible and can be prevented or managed with prior awareness of the triggers, that is trauma, stress, and genetic. So self-monitoring and multidisciplinary approach as observed by Powers 1996 are important, with the dietitian playing a critical role in the choice of nutritious and healthy diets. It's important to take note of individual traits which determine each patient's response to diabetes management and treatment. The versatile change in technology should be noted when considering choice of the desired equipment. So next slide for references, please. And then we can go to the appendices. There are quite a number, but I'll just go straight. The next, after the references, we have next one. Next slide, please. Yes, we have the patient vital sign form. What you look for in the patient, that is the gender, age, weight, and pressures and pulses and all that. Next, there's an appendix for the next, yes, the World Diabetic, a select world diet by William Russell. That is a lot. Indian diet is there. There is the Mediterranean diet, Nordic, French diet, Italian, many others. A select of them. Then the next one, please. Next. Yes, that is the Mediterranean diet for beginners by David Daniels. He also noted the foods which are high in zinc, vitamin, biotin, potassium, and omega. Next slide, please. Next. Yes, that one. Easy Diabetic Recipe by Arya Cooper, Facebook 2025. He noted the high sugar fruits, which are bananas, grapes, pineapples, and many more. You cannot eat that if you are really if you only eat that if your sugar levels go down lower than normal. But there are also the low sugar, which are recommended for diabetics. That is peaches, strawberry, avocado, which we have noted has good fat. Blueberry is very good for that. Apples, oranges, and many others in season. We cannot go strictly by this alone, but you cannot, depending on the region where you come from. The ones that are best suitable and preferable and in season can be done. So before I end, I don't know whether you have I had already got some exercise, squatting exercise, which is very good for diabetics. When you squat, that's one all-in-one, all-encompassing exercise for a diabetic to go at once instead of making limb movements when you don't have time. You can squat a few times, and that will help. And then there is also the other things, the gadget I used, and the specification. If you have it, you can show. If not, then I think it's okay. And I end. And I also appreciate the organizers once more and the lovely participants for everything. I thank you for your listening.